A London heart surgeon was admitted to hospital with coronavirus. To his surprise, the doctor treating him had a familiar face. 20 years previously, Dr Chandra had saved a patient who'd had a heart attack. When Dr Chandra himself was admitted to hospital with COVID-19, his former patient, Shakil Rahman, was now his doctor. Well, we're joined now by the two doctors, Dr Shakil Rahman and Dr Chandra, who's still recovering in London. Thank you both very much for joining us. And what an extraordinary story. We'll start with you, Dr Shakil Rahman, if we can. So you've been treating COVID patients. It must have taken a physical, emotional toll. But what happened when you recognised the patient who came in that you had to look after?
Thank you. Yes, Chandra, who we both stayed in touch for the last 20 years as professionals and colleagues. When he was brought in, I was on call that day, and it was height of COVID emergency, and seeing him looking frail and unwell brought back all those emotions that when I was ill and required being rescued. So I saw him immediately as any COVID patient when people were coming in the large numbers. I had a brilliant team. We admitted Chandra rapidly, and he was with us for about 10 days. And it was certainly brought back a lot of emotions, and I was grateful to Chandra for the trust he placed in me, and his family, the trust they placed in me and in my team. And we were so overjoyed when, after 10 days of struggle, he started to improve, showed signs of recovery. Initially, he did have both lungs affected with COVID pneumonia. It was quite critical, but seeing him recovering and then leaving hospital was absolutely a joy. And we all lined up to clap for him when he left hospital in the arms of his family.
I'm sure for every patient it is a huge victory and emotional when someone walks out of hospital having recovered, but this was obviously a more special relationship. Dr Chandra, for you, first of all, how are you feeling? And I know you're still recovering. What did it mean to you to have a familiar face treat you 20 years on from when that original surgery took place?
Good morning, Rosie. It was a pleasant and relieving surprise to me when I saw Shakil treating me. I am at present feeling much better, but still cough is troublesome. You have to apologize me if I cough in the middle. It's not too bad. I need to gain more strength. Where I had fever for about 5 days. At that time, it was like a flu. You take a paracetamol, you feel all right. But 6th day onwards, it was quite troublesome, non-stop cough, and the fever was not responding to any treatment. So my wife decided to take me to the A&E, and we called the ambulance. They took me to Epsom General Hospital where Shakil is working. I didn't expect him there, or I didn't think of it anything. I was so ill, and I was happy and relieved. I mean, not that I don't believe other doctors, but a familiar face when he was so ill was very good.
It's brilliant to see that you are definitely out the other side of this and recovering. Just finally, Dr Shakil, what's it been like for you? So I've just thrown my pen on the floor. What's it been like for you treating patients day in, day out? Are you seeing an improvement in the level of patients that you have? And do you feel like things are starting to improve?
Oh, absolutely. We are so relieved that the initial absolute sort of build-up of patients have declined. We have seen in our own hospital and other parts of the country that the patients who are ventilated, struggling on the non-invasive ventilators, are all coming down in numbers. We have had several discharges, successful discharges going home. But the important thing is that the follow-up of these patients is very important because they are not fully recovered. They need to be seen, yes, and to make sure that they do not have further future complications. But we are seeing excellent recoveries.
And this case is absolutely brilliant and heartwarming for you both. Brilliant to see you've still kept up that relationship for the last 20 years as well. Dr Rahman, thank you very much. And Dr Chandra, and we wish you the best with the rest of your recovery. Thank you both.
Thank you.
Thank you.